Hi friends, welcome back. Today we are discussing on the GPAT question paper pattern and the previous question paper. Now the GPAT exam is conducted by NTA. It is a computer-based online test and the duration of the exam is 3 hours and it is an objective type question and you will get 125 total number of questions. For correct answer, you get 4 marks and for wrong answer, you will deduct 1 mark from the correct answer score. This is the normal pattern for the GPAT. GPAT is Graduate Pharmacy Aptitude Test. So let's see in detail about the GPAT question pattern and the syllabus. First of all, I think it is better to think about what is the importance of this exam GPAT. This GPAT is required for those who are seeking admission for MPharm. This MPharm is important for those who are seeking higher posts in pharmaceutical industry. And this GPAT qualified candidates can receive a scholarship during the time of MPharm admission and have better chances in placement in best companies of the world. And the GPAT qualifiers are also eligible for NIPER, JEE, etc. and also eligible for various government fellowship. And the GPAT qualified candidates are eligible for the admission in PhD at various universities of India. These are the importance of this exam, GPAT. So when we analyze the previous question papers of GPAT that is conducted 2020, 17, 18, 19, today we are going to discuss the 2019 question paper. In 2020, we can see the importance area that is important in that exam is the pharmacology part, the rheology chapter, the juris subject, cosmetic like that. But in case of 2017, it is an easy exam that is compared to other GPAT exam. Here we can see an importance for the Suetics branch in the 2017 exam. Exam is easy. 20 questions are asked from the Suetics part. That is an easy question compared to other questions that are asked previously. But the cognizy is in difficult mode in that year and analysis question asked is around 30. But we analyze the 2017 question paper GPAT, we can find out in all the year the difficulty level arises from the chemistry part. The thing is that for cracking or clearing the GPAT exam, you should be thorough with the concept. In whole BPharm, we are all studying the BPharm syllabus and from GPAT syllabus, we are getting the question from GPAT. For clearing, the basic thing is that we want to know the concept clear that we studied in our each semester of BPharm syllabus. That is very much important. This is a national-wide competitive exam. So we want to, first of all, we are going to analyze the things. That is, in the exam, most chemistry part, we may get around 25 to 30 questions. And about 50% you can cover it. And ecology is also from 15 questions are there, from 125 questions. The pattern of questions is that you may get around 20 to 30 for the subjects, Suetics and chemistry. From cognizy, you may get around 15 part, analysis around 15 questions, and juris management, etc. You may get around 5 to 10 questions. So among the 125 questions, the basic thing is that you want to know the concept clear from each and every subject and to cover entire syllabus that we given in the GPAT syllabus. So first of all, I think we may go through some of the questions that may ask in the GPAT 2019. First question is that for protein detection, the most commonly used prop. This is from the pharmaceutical microbiology question. part, this question is that for that we know that different things are used for the protein detection. This question is asked from the blotting technique. That is, in Western blotting, we studied that the protein is transferred from the polyacrylate gel to the nitrocellulose layer, and this is done with the polyclonal and monoclonal antibodies. So we studied this for using the probe in this Western blotting or blotting technique. We are using the antibody based probes to obtain the specific information about the target protein. So the mostly used technique is Western blotting. From the Western blotting itself, we can know that we are using the antibody based probe. So for protein detection, the question is that the most commonly used probe is, so its answer is antibody answering. So we want to know what is Western blotting. We are utilizing antigen or antibody interaction probe is utilizing. So it is exactly antibody. So the answer is option B. Second question, ELISA is based upon. As we know, ELISA is enzyme linked immunosorbent assay. These are used to detect the antibodies in blood. The basic concept is that antigen-antibody interaction. Here, we know that antibody is a protein produced by the body's immune system against the harmful substance which will act as an antigen. It will act as a foreign body to our body. So, antigen-antibody interaction is carrying out, or it is the basis of ELISA test. So, option C is the right answer. Next question. In India, the patent office has its head office at Kolkata and branch officer. This is asked from the juris part. As we know, there are 4 patent offices in India and the head office at Kolkata. The branch office is at Chennai, Mumbai and Delhi. So the answer is option D is the right answer. Next question is from the basic part, that is the relationship between the emissive power of the surface and its absorptivity is given by which law? In the initial semester, we go across some of the laws. So we want to know which law gives the relationship between the emissive power of the surface and its absorptivity. The right answer is Kirchhoff's law. Kirchhoff's law will give the relationship between the emissive power of the surface and its absorptivity. That is, we know that an arbitrary body emitting and absorb the thermal radiation, that relationship is given by this Kirchhoff's law. That is, emissivity is equal to absorptivity. In some cases, this emissive power depends upon the angle. Here, the white body emissivity is 0 and the black body emissivity is 1. So, the Kirchhoff's law gives the relationship between the emissive power of the surface and absorptivity. Whereas option A, the Stefan-Boltzmann law that depends upon the temperature, that is W is equal to epsilon sigma T raised to 4, where sigma is the Stefan constant. Whereas the Darcy law, it is related to the permeability. That is, if a horizontal flow passes through a porous material, what is the change in permeability? That is the relation given by the Darcy law. Whereas the Fourier's law, that is related to the law of heat conduction. That is, the rate of heat transfer is directly proportional or normal to the direction of the heat flow and temperature gradient. That is Q proportional to A. That is given by the Fourier's law of conduction. Next question is from the biochemistry part. The retention hyperbilirubinemia is caused due to which condition? The retention hyperbilirubinemia. As we know, this retention hyperbilirubinemia caused due to the overproduction of bilirubin due to the biliary obstruction, etc. So option D is the right answer. Retention hyperbilirubinemia is caused due to the overproduction of bilirubin. That is the option given in our answer. Other may be due to the biliary obstruction that may also result in hyperbilirubinemia. This elevated level of bilirubin, that may be an indication of a liver damage or disease. Note that. Next question, the following ACE inhibitor used in treating cardiovascular disorder is synthesized from the natural amino acid L-alanine and L-proline. For this, we want to know the medicinal chemistry. That is, what is the precursor of the cardiovascular drugs? Among the ACE inhibitor given in our option, the enalapril obtained from the natural amino acid L-alanine and L-proline, whereas the enalapril and lisinopril having the same phenylalanine group is there, whereas in captopril, proline and propionic acid is there. So, the ACE inhibitor used in treating the cardiovascular disorders synthesized from natural amino acid L-alanine and L-proline is enalapril, option B. Next question, choose the correct sequence of process during atomization in AAS, that is atomic absorption spectroscopy. The atomic absorption spectroscopy, the basis is Beer-Lambert's law. In atomic absorption spectroscopy, we are using the hollow cathode lamp as the light source, tungsten as anode, and we are using inert gases as neon or argon. The process is that first we want to nebulize, that is we are creating a fine aerosol and we are introducing into the flame and mixing into the aerosol and fuel. That is first step is nebulization. After that we are going the process of desolvation, volatilize, dissociate and ionization. So the correct sequence of process during atomization is that option B is the right answer. And finally, we are using in AAS, we are using the photomultiplier tube as the detector. So we want to know what is the order correctly for answering this question from analysis part. Next question, identify the molecule which will not exhibit dipole moment. As we know, the polar molecules having non-zero net dipole moment. For example, in case of carbon dioxide and water, these are two polar phases. In carbon dioxide, the structure of carbon dioxide is linear. So, the dipole moment get cancelled each other and become non-polar or not exhibiting dipole moment. So, the correct answer is, our question is the molecule which will not exhibit dipole moment. So, the correct answer is carbon dioxide, option A. Whereas other example, water. Water is having a bent molecular structure, so it will exhibit a dipole moment and showing polar nature. Next question, the following combination of drugs are used in treating severe traveler's diarrhea. This is a direct question and we will study this from pharmacology part. The correct answer is the trimethoprim and sulfamethoxazole are used in treating the severe traveler's diarrhea. In addition to treating severe traveler's diarrhea, this combination, that is the trimethoprim and sulfamethoxazole combination, are used in UGA, ear infection, etc. So, the correct answer is option D. Next question, the reaction of alpha haloester with an aldehyde or ketone in presence of a base like NaNH2 gives alpha beta epoxy carboxyl ester. This reaction is referred to as. Normally, we get 1 or 2 questions as main reaction in GPAT question paper. So, this reaction, that is the reaction of an alpha haloester with aldehyde or ketone in presence of an ester, that is alpha beta epoxy ester, otherwise known as glycidic ester. If we know this thing, that is alpha beta epoxy carboxylic ester as glycidic ester, we can find out the answer. The right answer is Darson glycidic synthesis. Here, An alpha haloester reacts with aldehyde or ketone that may result in alpha beta epoxy carboxylic ester, otherwise known as glycidic ester, and the process is known as Darson glycidic synthesis. Whereas the other option, that is Vilgarod rearrangement, that may result in the reaction, that is the aryl alkyl ketone converting to the amide, that is a reaction taking place in Vilgarov rearrangement. And a side reaction also happens this, that is a carboxyl group obtained this Vilgarov rearrangement. Whereas in Bamford-Stevens reaction, the tosyl hydrazone reacts with a strong base and result in formation of an alkane. Whereas in case of Baeyer-Villiger rearrangement, here oxidation of a ketone happening in this Baeyer-Villiger reaction, and there's a migration step happening over this, and this migration step is the rate determining step, and finally causing a deprotonation of the oxocarbenium group. That is, finally oxidation of ketone resulting in the final product by using the peroxy acid. That is happening in the Baeyer-Villiger rearrangement. So we want to go through the name reactions also for the GPAT exam. Next, again from the biochemistry part. Next question, the von Geeks glycogen storage disease is due to the effect of this enzyme. Von Geeks glycogen storage disease is a condition in which our body cannot break down the glycogen. This disease is also called the type 1 glycogen storage disease, GSD1, and the symptoms of this condition is that the patient show a heat intolerance, bruising, low blood sugar level, enlarged liver, and swollen body are the symptoms of this von Geeks glycogen storage disease. And the reason is due to the effect of the enzyme glucose 6-phosphatase. Glucose 6-phosphatase, otherwise known as amylo-1,6-glucosidase, and this deficiency of this glucose 6-phosphatase result in the von Geeks glycogen storage disease. This is a group of inherited metabolic disease. So option D is the right answer. Next question, the blockade in beta oxidation result in. We know this beta oxidation related to the fatty acid conversion into acetyl-CoA, and the blockade in beta oxidation result in the sudden infant death syndrome. This sudden infant death syndrome is an unexplained death condition, usually occurs in 1-year-old child or less than 1-year-old child during the time of sleep. This is mainly due to the defect in the fatty acid oxidation and result in cellular energy shortage that finally result in this condition, the sudden infant death syndrome or SIDS. So blockade in beta oxidation result in sudden infant death syndrome, that is option C is the right answer. Next question, the basic ring system present in the antihypertensive and anti-glaucoma drug timolol is. The basic ring system, we want to know this timolol is a beta blocker having a propanolone structure. Here the timolol S form is more active than R form, and this timolol is used in glaucoma, hypertension, angina, myocardial infarction. The basic ring structure is 1,2,5 diazolan morpholin is the basic ring structure, and this is used as an antihypertensive and anti-glaucoma drug. Next, we are dealing with the pharmaceutic. From pharmaceutic, the questions are simple. As we know, with the clear concept, we can clear all the questions. First question, the shake well label must be placed on the containers of. The shake well label must be placed on the container in case of ophthalmic suspension. You want to shake, otherwise may cause settlement. To avoid this, we are giving the label shake well. So option A is the right answer. Next question, in case of aerosol testing, valve delivering acceptance for a value of 54 microliter or less is. As we know, we are dealing with different quality control tests, what is errors or like that. But the most important part is valve. If valve is not good or not clear, that may result in leaking. So two parameters or valve delivering acceptance is the if the delivery acceptance for a value of 54 microliter or less, that show a limit of plus or minus 15 percentage. Whereas if the criteria is size between 55 to 200 microliter, show a acceptance of plus or minus 10 percentage. So it is our question is 54 microliter or less. So the correct answer is plus or minus 15%. Next question, which of the following viscometer can be used for characterizing the non-Newtonian system? Non-Newtonian system examples are YouTube and Oxford viscometer. We know the viscometer based on the Newtonian and non-Newtonian system. The capillary viscometer follows the Newtonian system and it depends upon the Poisson law. Whereas the Pauling sphere viscometer also depend upon the Newtonian fluids, and Poisson sphere or rheometer that is non-Newtonian, whereas a rotational viscometer that is a non-Newtonian liquid. Whereas among the options, the Gpat viscometer, which will use for characterizing the non-Newtonian system. So option D is the right answer. The Gpat viscometer are of two types as we know, Surly type and Cuvette type, and the best example for the Surly type is the Brookfield viscometer. So the Gpat viscometer is utilized for characterizing the non-Newtonian system. Next question, the roll tube technique is a modification of, again from the Sutics, that is the microbiology, biotechnology chapter. The roll tube technique is a modification of the streak plate technique. This streak plate technique is utilized to isolate the stringent anaerobe, that is split microorganisms that grow only in the anaerobic condition. So the streak plate technique is the modification of roll tube technique. Option B is the right answer. Next question, 21 CFR part 211 of USFDA describes. This is related to the current good manufacturing practice we are studying. So now this 21 CFR part 211 related to the current good manufacturing practice or CGMP. Next question, in treating the immunodeficiency disease, the goal is to maintain IgG level at above. The IgG level is at about 200 mg per deciliter is the correct level for IgG. Whereas for IgM and IgA, it should be less than 20 mg per deciliter. Next question, which of the following is the property of microemulsion? We know that microemulsion size is between 10 to 100 nanometer. So more than 1 micron is correct, and they have a poor stability, and this but thermodynamic stable is a property of the microemulsion, and from the correct and showing a clear translucent, but the option D is wrong. The correct one among the property of microemulsion is that it exhibits a viscoelastic gel phase, that is it having a low viscosity with Newtonian behavior are seen in case of microemulsion. So option C is the right answer. Next, again from the rheology chapter, the rheological and functional properties of synovial fluid are impaired due to. It's a twisting question. We want to know the concept here. We want to know the rheology as well as the concept of synovial fluid. As we know, this articular cartilage and synovial fluid are closely linked to for the proper lubrication of the joints. So, if there is decrease in the content of hyaluronic acid, that may result in the impairment of the synovial fluid. So, option D is the right answer. The rheological and functional properties of synovial fluid are impaired. So, we want to know the basic concept. This is due to the decrease in the content of hyaluronic acid or HA, endogenous HA. Option D is the right answer. Next question, in tablet, the hydroxypropyl methyl cellulose is used. HPMG is used as a copying agent as well as a film former. So option B is the right answer. The best example for the diluent of fillers are starch, lactose, sorbitol, xylitol, etc. Disintegrate means it will help to break the tablet. And that example, starch, cellulose, etc. And the binder used in our products are the sucrose, gelatin, starch, etc. Moving to the next question, the Dakin solution synonym for. Dakin solution is, it is basically the diluted solution of sodium hypochlorite. So option B is the right answer. Dakin solution is chlorinated soda solution. Whereas the option, this aluminium acetate is also known as Domi-Bromo. So Dakin solution is synonym for the chlorinated soda solution. Option B is the right answer. Next, we are moving or dealing with the pharmacy practice question. Medline, M-base, EBM and IDAR. These are examples for the databases. Databases means we are using this biomedical information for the studies, whereas compendial means it is related to the pharmacopeial standard. Chronicle means that is we are using the accounting events arranged, that is according to the time path we are using the interpretation of the final result. Next, we are dealing with the inorganic chemistry. The soda ash is also known as sodium carbonate. Option D is the right answer. The sodium carbonate we are using in the manufacture of dye, coloring agents, synthesis of detergent, fertilizers, etc. Also option B is the right answer. Again from Cutics, the MCC, that is the microcrystalline cellulose, is also called as Avicel. Avicel is the brand name of the microcrystalline cellulose, and MDEX means the 100% water soluble lactose free tablet binder is known as MDEX. And this Avicel, the microcrystalline after cellulose, is also utilized as Avicel. So microcrystalline cellulose also called Avicel. Option D is the right. Next question, the co-administration of erythromycin with cyclosporin. We are administering erythromycin with cyclosporin. This is utilized to increase the bioavailability due to the inhibition of hepatic metabolism. And we are getting this question from the pharmacology part. Next question, the essential hospital formulary system provide mechanism. Hospital formulary system are done to avoid the duplication, that is simply to avoid the brand and therapeutic duplication. This hospital formulary system help to knew the current clinical use of the medical staff and also to evaluate the medical agent and to avoid the errors. Next question is from the biopharmaceutics. The volume of blood flow per unit time per unit volume is simply the definition of the perfusion rate. Perfusion means the rate at which the blood passing through. That is perfusion rate. So the option D is the right answer. Next question, we are dealing with the pharmacognosy. The size of the lycopodium spore size, we are dealing this in the quantitative microscopy in the pharmacognosy. This quantitative microscopy are used when, especially the chemical and other tests are difficult to evaluate the drugs. So we go for this quantitative microscopy. In this lycopodium score method, we are studying the uniform size is 25 micrometer on an average of 94,000 spores present per milligram of lycopodium spores. So 25 micrometer is the correct answer. Next question, rico-alurins AF have been isolated from. This is a product that is obtained from the kursi. So it is isolated from kursi is the right answer. Next question, the pungency of gingiber occasionally rhizome due to the presence of this, and repeatedly asked question. The pungency of ginger is due to the content gingerol. Option B is the right answer. And the option citral means it is a combination of nerval and geraniol. This is the reason for the aroma and flavor. So aroma and flavor is due to the citral and pungency is due to the content gingerol. So option B is the right answer. Next question, the principal cultivation area of pyrethrum flowers. The pyrethrum flower cultivation area is at Kenya. Option D is the right answer. Next question, in Cassia angustifolia, the short-term drought is due to the increased concentration of sinusoid A and B. In case of short-term drought, there is increase in the concentration of sinusoid A and B, whereas in long-term drought, that may result in severe loss of leaf biomass. Now this option A is the right answer. Next question, the glycoside celeroside in red squill. The celeroside in red squill act as rodenticide. Option B is the right answer. Next question, the characteristic microscopic features observed in Alzheimer's disease is due to the. In Alzheimer's disease, that is due to the presence of neuritic plaques containing A beta amyloid. Is the right answer. Option D is the right answer. Next question, the cardiac output. The cardiac output means simply it is the volume of blood ejected by the left ventricle per minute. It is cardiac output. So it is a definition of stroke volume. It's the amount of blood pumped by each ventricle per beat is around 70 to 75 ml. What are sutures? The sutures are related to the fibrous joint of the skull. Option D is the right answer. We know that different frontal, sagittal, lampoidal, squamous, like that. So these are sutures are fibrous joint of the skull. Option D is the right answer. Next question is an analyzing question. Following are the facts regarding clinical application of muscarinic receptor blocking. Identify the false statement. We are dealing with the application of muscarinic receptor blocking. In muscarinic receptor blocking, we are utilizing this muscarinic receptors are used in the case of Parkinson's disease. So it is a correct answer. Next, option C. This muscarinic receptor blocking may result in Meniere's, right? And all remedies for treating seasickness is copeland is also right. So false statement is option B. That is, in muscarinic receptor blocking, there is decrease of cardiac output happening, but in the option B, write that improve the cardiac output. It's wrong. In muscarinic receptor blocking, that may result in AV block and decrease cardiac output. So false statement is option B. So this type of analyzing question are also seen in our question pattern. Select the ulcer protective drug from the following. This is a right easy question from the pharmacology part. As we all know, sucralfate. Option D is the right answer. It is a ulcer protective drug. Next question, the disturbance of the estrogen or progesterone balance causes a relative deficiency of which enzyme? That may result in disturbances in dopamine and finally in emotional disturbance and depression. As we know, in the estrogen progesterone balance is seen, that is, progesterone deficiency may result in estrogen rise. So, in such cases, we are administering the vitamin B6. Vitamin B6 means pyridoxine phosphate deficiency that may result in the disturbance in the production of dopamine and finally result in emotional disturbance and depression. So, pyridoxine phosphate deficiency result in disturbances in estrogen and progesterone. So, this vitamin B6 that is essential for the production of progesterone also regulate the mood and result in anxiety and also needed for the production of dopamine serotonin. So option C is the right answer. Next question. The testing of chemicals by OECD guideline number 420. OECD means Organization for Economic Cooperation and Development. This is an organization for testing the chemical, and OECD guideline number 420. We are studying this in acute oral toxicity, especially for the fixed dose procedure, and this number 420 deals especially done for the procedure that is doing with the rats. So option D is the right answer. Next question, which of the following is true? Excessive use of diuretic can lead to. Excessive use of diuretic can lead to hypovolemic shock. Hypovolemic shock means it is a life-threatening condition. We are losing more than 20% of the body fluid and may result in life-threatening condition. This may be due to excessive use of diuretic. In addition to the hypovolemic shock, it also results in the hyponatremia, metabolic acidosis and alkalosis, etc. So, diuresis means increase in the diuretic that may result in diuresis and natriuresis and causes an reabsorption of sodium, etc. So, we want to know the side effect while administering a particular drug. But we are winding up the discussion part of the GPAT exam pattern and exam analysis. We are winding up. Hope this session will be helpful for you. If you are interested to get more details about the various competitive exams related to the pharmacist, go to this link. And we are starting a coaching for the GPAT soon. The admission is going on. If you are interested, you can also contact. Thank you for watching. If you are not subscribed till now, please subscribe and enable the bell button to get further notification. Thank you.